following symptoms is most likely to be present in this patient? Okay, 60-year-old woman presents to her PCP with complaints of fatigue, weight loss, constipation for the last 3 weeks. She has a history of osteoporosis and has been taking over-the-counter vitamin D supplements at a higher than recommended dose. Her lab results show an elevated serum calcium level and increased level of 25 hydroxyvitamin D. All right, which else is so stones, bones, groans, and the psychiatric overtones, possibly for the hypercalcemia. Let's see. Um, hmm. It's usually polydipsia, tachycardic, increased calcium level, so she's taking too much of that vitamin D. I know that the hypocalcemia is the muscle, like the Trousseau sign. I'm pretty sure it's hypo, unless that's hyper. Let's see, tachycardic, I don't like. Hypotensive, I don't like. Polyuria, polydipsia, I don't really like.
Okay. Where's
I
your
don't
gut?
think you can get seizures from that. I mean, muscle spasms is the only, let's see, weight loss, fatigue, constipation. She has osteoporosis. Osteoporosis, your lab levels are normal though. But she's taking way too much vitamin D. There's nothing with like stones here. Hmm. I don't like this answer, but I don't know. I don't think seizures. Can you have a seizure with too much calcium? I don't know if that's in any. I don't think so. I guess I'd go muscle spasms, but I'm not confident.
Okay, so let's talk about this. Okay, so polyuria polydipsia, right? Too much calcium.
Okay.
Hypercalcemia can cause, increased urine and
Oh, I didn't know
increased
that.
thirst
Okay.
just because, decreased water absorption, increased urine output. That's because you have
Okay.
way too much electrolytes, right?
Okay.
Tachycardia, right? Usually, right, any kind of heart issues, right? I usually think of more potassium based. They say hypo can cause bradycardia. I didn't know that, but it can. I mean, I guess electrolytes in general can, but like I said, heart issues I kind of
I was thinking in the opposite because I was like, well, wouldn't like
no, it
calcium
deals with
channel
conduction.
blockers, right? Like
Well,
that's
it's going
not
to deal with like conduction. So I can't remember exact pathomechanism, um, but not 100% sure.
okay.
I would have to look that back up. But hypotension, right? That's not really, that's not anything to do with that. That's usually sodium, right? If you have too little. Muscle spasm is usually hypocalcemia, like you thought,
Okay.
not hyper. Seizures are usually more common with sodium issues.
Okay.
So I always think seizures is usually sodium.
Okay.
Heart issues is usually potassium.
Okay.
Hypotension, sodium, right?
Sodium again.
Hyper or
Yep.
hypo is too much sodium or too low sodium. Muscle
Okay.
spasms, hypocalcemia, and then having too much calcium, you're going to try to pee a lot. So
I was thinking of just polyuria, polydipsia. They're going for like something diabetes.
sure, you can
Like, oh,
definitely
I
have
don't
that there
see it
too.
here, but that's why I kind of threw it out so fast.
No,
It
that's
makes
okay.
sense. It makes
Yeah, I
sense.
mean, this is, some of this stuff is that you're getting into the weeds of electrolytes, of course, right? But just remember the highest yield stuff that we talked about, right?
Okay.
Sodium, sodium, like I said, seizures, blood pressure. Potassium is usually cardiac. Magnesium is also cardiac. Calcium, like you said, usually, the mnemonic you talked about, hypocalcemia, and then you can add on polyuria, polydipsia for hyper.